to be able to put this webinar on for you all today on returning to work and risk management, especially during this time of COVID. I'd also like to thank Mutual of America for their support in helping us to put on this webinar for our community. So a few logistics before we get started. So today's session is expected to wrap up around 2:30 p.m. The webinar is being recorded and will be made available to everyone who registered after the webinar. I will be present throughout the session to providing background support. So shortly I will be posting my phone number and email in the chat box. So feel free to reach out to me anytime throughout the session if you have any connectivity issues. And let's see. So again, anyone who's just joining in, I encourage everyone to introduce their name and organization name in the chat box. Feel free to post any questions that you have during the session in the Q&A box, and Lily and I will be addressing those throughout the session. We will be taking a 5-minute break around 1:45 p.m. today. And let's see if there's anything else. So with that, I'd like to introduce you all to Lillian Romero-Gomez. She's the president and co-founder of Baker, Romero Associates. She's a longtime affiliate of the nonprofit partnership. She's put on many trainings for us on risk management, so we're all in really good hands with her. And Lillian wants me to remind you all that she is an insurance broker. She's not an attorney. Therefore, all the information provided today is for informational purposes only and is not to be construed as legal advice. So with that, I'd like to welcome Lillian. And Lillian, go ahead and you may go ahead.
Well, good morning. Can everybody hear me? Are you hearing me, Judy?
Yes, I can hear you.
All right, so as Judy said, my name is Lillian Romero-Gomez. I am president of Baker, Romero Associates. I started my company in 1986, and that's a hard thing to say, but it's true. And a lot has happened in the last 30 years with regard to the nonprofits that I work with and the insurance industry as a whole. Having said all of that, nothing has prepared the industry or my nonprofit clients for this pandemic. And I want to start off with something I just got on my phone, and it says, the US surpasses 4 million reported coronavirus cases and sets a new record. And apparently in the last, 15 days, 1 million have been added. So we're still in the thick of this isn't moving. We're still in the thick of the virus. And so just bear with me a moment. I'm having a different, is it moving now? Okay. So I want to get started. I like to start things on a positive note, even though we've just got some bad news here. And it's about getting ready for the return back to the office. You know, a few months ago in March, when I was talking to many of my clients, everybody was getting ready to go back to work at home. And there was a lot of panic at that time. But now there is a different kind of panic. We see that there is going to hopefully be an end in sight soon, even though right now we have some bad news. But we as business owners, as administrators of nonprofit organizations, have to focus on how are we going to deal with COVID. It's not going to go away, and yet we have to go back to work. So we're going to talk about the way we deal with it in insurance for risk management is to deal with how do we manage this risk. We have to go back to work at some point, and how do organizations safely do it? So we're going to talk a little bit about what are the basic guidelines for doing this. I'd like to start off by talking about actual questions. These are all questions that I'm going to share with you that my clients have asked me just in the last 30 days. And they're a little different from what was happening a few months ago. We'll talk about the responsibilities of the board of directors because they have a fiduciary responsibility for the wellness of the organization. We'll talk about what are the issues and the risks about going back to work. And again, this is from a risk management perspective. And then we'll talk about insurance and COVID. Insurance is not, nor was it planned to insure a pandemic. I'm sure you've all heard this. And if those of you that have filed claims perhaps for business interruption have been declined. But lots of changes are going to happen. as a result of this pandemic. And so we'll go over some of the more basic coverages and what may or may not help your organization. So these are the most common questions that we have, and I'll just go through a few of them. But again, these are more than one client in the last 30 to 60 days have asked me these type of questions. And the first one is, will our workers' compensation insurance policy provide coverage if an employee claims she contacted the virus while she was working from home? I clearly remember this phone call because it was an HR director who was extremely upset and disappointed in herself, because she said, you know, I made sure that when everybody went home, they had all the supplies they needed. If they needed something, we made sure it was delivered to them. If they had to have a new laptop or whatever, we made sure that they were safe at home. And she did everything right, but this is COVID. And what didn't factor in her planning was that she lived with 2 teenage sons. And one of her sons did contact the virus, and so did she. They're all fine now. She was out of work for about 3 weeks, but they are all fine right now. And she did file a workers' compensation claim, and it is being dealt with. And by the way, it has become a very costly claim, but she's being cared for. The next question, can we have employees sign a waiver and limit our responsibility if they contact COVID-19? My first thought would be, wouldn't that be nice? But with regard to workers' compensation, you cannot sign away your workers' comp rights. With regard to using waivers for other uses, waivers are great. Can you get rid of COVID-19 liability? I don't think so, but this is a legal question. But the reason I even address this is because you may remember a month or so ago, the President of the United States had I think it was a fundraising event, and you saw on television that he was requiring everyone to sign a waiver so in case they got COVID. I frankly don't know how that's going to work, and the attorneys I've spoke to are not too sure about it either. And maybe that's where that question came from. The next one, will our general liability policy defend our organization if we are sued because a client contacted or contracted COVID? In general, your general liability policy would defend your organization if, say, for example, a client or someone that comes onto your premises were to contact the virus. But there are exceptions, and a little later on in the presentation, we'll talk about them. The next one, we are planning for a special event next year. Can we purchase event cancellation insurance in case we have to cancel the event? Well, I love the fact that they're thinking in terms of starting up next year. That certainly gives me hope. Special event coverage, it is available right now, but there are exclusions having to do with this COVID. I don't know how things are going to look like 3 months from now. Maybe the market will loosen up a bit, but right now, in general, there's not a lot of coverage for that. We will be renting office space to another nonprofit because many of our employees are opting to work from home, so we have a lot of extra space. Can we add this other nonprofit to our general liability policy? And the answer is, generally speaking, no, you can't. If you have another nonprofit, they need to be carrying their own insurance, and you have now become the landlord, and so they should be providing you with a certificate of insurance. Discuss this with your attorney. There should be the appropriate lease or agreement. And we're starting to see a lot more collaboration between nonprofits or between nonprofits and other entities. Make sure that you have the appropriate MOU, no matter how small your agreement or collaboration with them may be. That will protect you long term, and it is an effective risk management policy to have in place. We want to request that older staff or staff with health issues have their temperature taken before they come to the office so that we can protect them from the virus. Well, first of all, this is sort of a legal issue, but what I can say to you is I think that taking temperatures, if that's what works for your organization, is appropriate. What you cannot do and should not do without the advice of counsel is to discriminate and just pick some and not the other. Not a good idea, but do discuss that option with your attorney. The next question, it's another collaboration question. We are collaborating with another nonprofit, and they have asked us to add them as additional insured since they do not carry insurance. This is a very small grassroots type of organization, and they want to be covered under this larger organization because they are helping each other. And in general, I would say that is not a good idea, but review the MOU and discuss with your attorney. Insurance companies, again, want other nonprofits to carry their own insurance, and only if there is what we call an insurable interest would you add another entity onto your policy. This one just happened a week ago. We just had a ransom cyber attack. Will our general liability policy help us with the funds that are needed for this ransom? And unfortunately, the answer to that is no. The general liability policy specifically excludes this type of exposure, although there are many policies right now, general liability policies, that will offer some type of data loss coverage. So it's best to get a cyber policy. And by the way, because a large amount of our staff are now working from home, you have an increased risk in cybercrime. So you all should have a cyber policy. Discuss that with your insurance broker. And the last question that I have here is, we have made the painful decision to terminate a few staff due to lack of funding brought on by the pandemic. Will our EPLI policy provide us with legal protection if the executive director and the board are sued? We're getting a lot of this. And in the next year, according to the insurance industry and insurance attorneys, this is an area where there will be lots of litigation. The answer to this is, assuming that this is a claim that is insurable under the policy, there will be coverage. An EPLI policy stands for Employment Practice Liability. An employment practice liability policy is usually written in combination with your directors and officers liability. EPLI is designed to protect the organization for suits that are brought by employees having to do with wrongful termination, discrimination, and other employment-related issues. So make sure that you take a look at your actual policy, because this is going to be an area where many of my clients, by the way, are already getting hit. So risk management, if you go onto the websites, if you go onto the internet, you're going to find lots of information on the basics of risk management. And this is a very basic summary of what a basic risk management plan consists of. And I'm just going to go through it very briefly, because you don't have to do all of these steps, but this is basically how an effective risk management plan works, especially as we are planning now, how do we get our employees back to work at some point in the near future? Well, first of all, you have to find a team of people that are going to work with you. It should be more than one person. You should have a team of people that could be from your board of directors, your employees, volunteers, independent contractors, people that are committed to your organization. And then you begin with doing, I call it a laundry list. The correct word is to identify risks. I say make a laundry list of what can go wrong in your organization. How can employees get infected with COVID by coming back to your organization? You need to look at that so that you can start to make plans as to how you can prevent them from getting ill or catching the virus. And then the next step is to evaluate the risks of returning to work. So once you look at how things can go wrong, there's a possibility that some staff may not be able to come back after you have evaluated the exposures having to do with COVID. There are others where you're going to have to come up with solutions so that they can effectively go back. And then the final part of risk management has to do with controlling the risk. And basically that is this. Once you've done everything and you've planned everything that you can to make your organization safe for employees to come back, there are still some things that you can't do. And that's where insurance comes into place normally. I say that because, as we see later on, insurance will not cover a lot of the exposure under this pandemic. But the use of waivers, I am a big believer in using waivers. It is a way to mitigate some claims and to help you from preventing some claims, and hold harmless agreements. This is where you should have your attorney working with you and not come up with some cut and paste job with regard to waivers or hold harmless. And then always review your safety program. There are so many changes going on right now, not only with the state and local county requirements, the CDC, the OSHA, everyone is doing changes all the time. And it's hard to stay on top of that, but you continually have to review so that you are in compliance with being expected. Because quite frankly, if someone in your office or department in your office is not staying on top of this, you are giving an attorney an excuse at some point to come in and sue your organization if an unhappy employee decides that they're going to sue you. And by the way, we are starting to see that. And this is just a common sense tip. Nonprofits by their nature are sharers, they share. So I would recommend that you ask other nonprofits about their return to work risk management policies and their procedures to mitigate COVID. By talking to other nonprofits or other community organizations, find out what they are doing to protect their staff and their volunteers. So board of directors. So directors and officers have a fiduciary responsibility to protect the organization, its reputation in the community, its agreements with the people of the community. The buck stops here. It stops with the board of directors. And board of directors, I know because I sit on some boards, are different. Some boards are very hands-on with the executive director and management. Others, not so much. Other boards of directors are very focused on fundraising and finding ways of keeping the business afloat. So my point in this is to tell you that the board needs to be very much aware of your plans for mitigating COVID. How are we going to prevent this from coming on? How are we going to run our organization? And the board needs to be involved and participate in this. And I also recommend, which is something a little new for me, that the board consult with an attorney during this time. They should have advice because they are held liable for what is going on right now with COVID. So if they don't have an attorney, they may want to look for someone that they can hire on a consulting basis, or they may volunteer their time. But this is a good time to be looking for someone as we go through this next year. And then from a risk management perspective, it is important to develop a safety culture and that everybody buys into this. Changing the culture of an organization is difficult, and you may not have a lot of time right now because we're all grappling with COVID, but it's important that everybody buy into and is informed of your safety culture, from employees, independent contractors, management, and let's not forget our volunteers who are critical to our organizations. We all need to be involved in preparing for a safety program that works for everybody and that everybody works together. This sounds like common sense, but you'd be amazed at the times when the board of directors is not very well informed as to what is going on, or that the volunteers are not being dealt with. This is a time, since COVID is high, if you're still working at home, that you plan thoroughly for everybody's return at some point, and especially don't forget the volunteers. So risks connected with returning to work. I think we've all seen enough information out there that we know that there will be risks coming back to work. And so we have to have policies and procedures at from the federal, state, local regulations, and develop policies that are going to protect our organization. And before I forget, I always like to say this: document, document, document. As we go through these next slides, remember that one of the most important things that will protect your organization long-term is that you do the appropriate documents, that whether you are having them, you have a plan for everyone, whether you are implementing temperature checks or sanitation, that everything is properly documented. You will need this type of information later on if there is litigation. So again, having the appropriate policies in place, the appropriate documents, is part of risk management and is what has to be done now. So I always say this, happy employees usually do not sue. I mean, I've been doing this for 30 years. Employees that feel that they're not being heard or are not informed tend to sue. So it's important when you're planning your safety procedures and your safety programs, your safety protocols, that you inform your employees of what is being done to make them safe, and that you not just say it once, but that continually they are reminded that they're important and that you are planning for their safety in the future. So they need to understand about what is going to be expected of them when they return to work. What are the work protocols. I have clients that have told me that employees are very worried about getting screenings because they don't want their information being put out there for someone else to know about. They need to understand how they're being protected, how their information is being protected. They need to be empowered with understanding what is going on when they come back to work. They need to have instructions, for example, if they're going to be bringing back to the office equipment, whether it's their own or equipment that is owned by the office, how is that going to be disinfected? Who is doing that? Is it doing it at their home? Is it coming back? Something as basic as that will empower them when they come back. Also, information on any changes in the work environment, which is, for example, restricting access to break rooms or social distancing. In our office, we have a little kitchenette area and we have a television, and during your breaks, we could go in there and have some coffee, watch television. We've just finished our kitchen area, and the television is gone, as are the table and the refrigerator. So we don't want people congregating in our kitchen area as we move on. We want them to go. If they want to have a cup of coffee, they can. There's no place to sit. You got to go back to your workplace. So whatever it is that you come up with, think in terms that you need to empower your staff, and they need to understand why you're doing this. Inform employees of the cleaning policies to prevent the spread of COVID. If you decide to hire a company that is going to come and do the deep cleaning, are they doing that weekly, monthly? What is it that you are doing? Your employees need to understand this so that they feel more comfortable coming into the office. Employees need to be educated about COVID-19 and how to protect themselves and the work environment. And I say that because there's a lot of misinformation out there, more than I realized, quite frankly. I have had clients call me and tell me that right now they are struggling with them, even talking to employees to come back into the workforce because they're horrified. They have heard horrific things about COVID-19, and they just won't come back.
Lillian?
Yes.
Sorry to interrupt. We have a question
Sure.
from Shared Science. How long should we keep screening logs and documents, especially logs that identify individuals?
I would talk to them because every community and every county is now different. And I have seen different things said at the state level. I would refer that to your employment attorney and HR person. I have had some attorneys that say, you keep this for the next 3 years. And I've asked, why do you use 3 years? And they said, because now employees can go back 3 years in California, I'm referring to California, and sue for acts that are happening to them right now. So I would save that. I would talk to an employment attorney as to what you have to hold on to and for what period of time. But I keep on hearing attorneys talk about the fact that employees can go back 3 years. So if you think about it this way, and if for something that happens right now, if an employee thinks they were treated badly or discriminated, or their information wasn't held confidentially, they have 3 years in which to sue your organization. So I'm glad you're asking that. And again, document, document, document. One last thing, reminder, address, this sounds really dumb, but I have to say it because I've seen this question come up a few times. If your organization has an elevator, elevators we are hearing is a place where COVID can hang out. So if your staff have to use the elevator to get to your office, you need to address that. How are you going to deal with that exposure? I had a client who called me and asked us for advice, and we sent them some information. But their solution to this, they start at 9 o'clock. And they're not going back till August, but they start at 9 o'clock. And they've decided now that they're going to start from 7:30 to 9, so that people come in at different hours so that there isn't a lot of people in the elevator. And my advice was, well, can they go up the stairs? I mean, it's great exercise, but they're on the 4th floor, and not the majority of their people are over 50. So again, the elevator is something you need to deal with in case you haven't already done so. I know I was going to say something else about COVID-19, but it's gone. All right, so develop an infectious disease preparedness and response plan. I've seen the state provide very good information on this. I've seen some counties provide. OSHA, they're providing information. I don't know if it's enough. I tend to see that they're not providing as much information as perhaps they might be, and the CDC. So it's important that you have a plan. Remember, document, 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 and that your plan include not only your employees, but your volunteers, and take into consideration the population that you have, your employees. Or do you have employees that are primarily older? Do you have employees that have chronic conditions, PTSD? Do you have people that are pregnant? How are you going to deal with this? Right now is the time, while you're still not quite back at work, to be planning for that. And then one of the most difficult challenges, of course, is social distancing. And how are you going to implement that? So I wanted to share this because I actually have made some pictures in our office, so that in every room, part of our plan for protecting and reminding our employees to be safe is to remind them, not just by saying it all the time, but by having it in every room. There's lots of, I just saw Staples has one that has lots of information on it, but you need to continually remind them about the basics of safety. Don't assume that everybody knows or that everybody will remember. It's important that your staff, be reminded that they are in this with you and that they have to participate in implementing safety practices. And one of the ones that wasn't in there that we added had to do with workers sharing phones, desks, headsets, equipment. I have an employee who says, we share, we're a small office. We share everything. And I said, you shouldn't share anything now. So whatever your organization has, sharing equipment is not a good idea. And again, when you go back into the office, don't shake hands. Face coverings. As you all know, in California, you're now required to wear a face covering if you're in high risk areas, but there are some exemptions, and the exemptions is what you have to deal with. If you have someone that truly cannot wear a face mask, what are you going to do? People that are younger than 2 don't have to wear a face mask. People with medical conditions don't have to wear a face mask. People that are hearing impaired don't have to wear a face mask. And people that are working, they're outdoors, don't have to wear a face mask. But again, if you have someone that has a medical condition and says to you that they cannot wear a face mask, you need to have a dialogue with them. What is going on, so that you can figure out how are you going to address this issue. On the other hand, and this happened to one of our clients recently, we had a client, they're planning on coming back in August. This client said to me that 2 of the employees said that it was their constitutional right not to wear a face mask, and that it was going against the rights, and that how face masks became political, I don't know. And that's not what this presentation is about, but this was a real issue that this employer had, that they didn't feel that they should be coerced into wearing a face mask. So after the employer, I always believe in having a conversation with them, truly understanding if they have knowledge, if they understand what this is about. Once they realized that these 2 employees had a political issue here, they referred it over to legal. I don't really know what's going to happen with this, but again, be aware. How are you going to deal with somebody who tells you this is a political issue, when you as an employer have a right to make sure that everybody else is safe and are requiring masks? So do be aware of that in case you wind up facing an issue like that. Social distancing. This is key and it is crucial, but also is very difficult for many nonprofits to implement. So how are you going to keep your staff safely apart from each other, at least 6 feet apart from each other, especially in break rooms or in cafeterias? If you still have cafeterias, how are you going to do that? Well, there are several strategies that can be used for social distancing, since we all know that this is key to preventing the spread of COVID. Number 1 is implementing flexible work sites, in other words, working from home. If you can continue to have employees work from home, if that makes sense for you, that is truly the best way to go right now. Implementing flexible work hours, in other words, have staggered shifts so that not everyone is there at the same time. increasing physical space between employees and work site, increasing physical space between employees and customers. I went into a client's office the other day just to drop off some information, and they already had partitions at the front, these plexiglass. And I thought that's great. This is what they're doing, and they're also implementing flexible hours so that they can come back to work. Implementing flexible meetings and travel options. My advice is postpone any non-essential meetings at this time, or do the Zoom meetings or remote meetings, and deliver as many services as you can remotely. I have a client, actually I have two clients that one of the multiple services that they provide is counseling and therapy. And as you can all imagine, there's a lot of anxiety right now. And so these two clients, their services, their need for their services has increased. Well, thanks through the media, to Zoom, they are able to help more people and provide them with counseling through using remote services. So for many of my clients, this media has been able to help them to help more people. Just a few more things to consider as you're returning to work is, number one, review your lease. For those of you that don't own the buildings, make sure that you review the lease and find out what precautions, if any, the landlord is putting into place in the common areas, the hallways, the doors, the bathrooms. Are they putting up hand sanitizers? How often are they doing deep cleaning? Are there safety signs? Are there rules? I have one client who, when I suggested this to her a few weeks ago, she said the landlord hadn't gotten back to them. You know, and I've had other clients where the landlords are very proactive and are letting them know this is what we're doing. So again, you need to be proactive as far as, you know, what is going on in your building. You may be able to control your office, but what is going on in those common areas, that needs to be addressed. And then on a personal note, airflow in the office. I have a daughter that was asthmatic as a child, so we were always very conscious about air conditioning, filtration systems. But there is CDC guidance suggesting that airflow in confined inside spaces can facilitate the spread of COVID. And I don't mean to be an alarmist because there are many variables, but you do need to be aware of that. And again, discuss with the landlord, you know, what air conditioning systems are in place, the duct system, what type of filtration is in place. And also this has to do a lot with the number of occupants that are in the building, but this should be addressed. And also consider a HEPA air purifier in your offices. I've always had a HEPA air purifier in my office and in all of the offices, even though we're in a modern office and there's an air conditioning system. A HEPA air purifier doesn't prevent COVID, but it does keep the air that your employees are breathing cleaner, and that is good for their lungs. So for what it's worth, I highly recommend them. They're not that expensive, and it is an effective risk management tool to protect and help your employees. So with that, we're going to now talk a little bit about insurance. Remember, insurance is a part of your risk management plan. It should not be considered your risk management plan. And what I mean by that is, clients have said this to me, we're so glad that we have insurance so we don't have to worry about COVID. And nothing could be further from the truth. There is no single insurance policy that will address the pandemic exposures. The insurance industry, our government, the world was not prepared for this. And so there will be challenges moving forward with regard to insurance. So this picture here is a summary of what most nonprofits carry for their agency. It's not a complete list, but it is a good summary of all of the coverages that nonprofits should carry to protect their organization and the board of directors. And I just want to caution you, because I'm starting to see it now, that because of COVID-19, there may be a reduction in limits on certain lines of coverage. I've also seen a reduction in coverages on umbrella policies. So when you start to receive notices from the insurance carriers that something is being limited at renewal, you need to contact your insurance broker and find out what exactly does this mean. By law in California, if at renewal, an insurance carrier is going to delete coverage, they have to let you know. And I don't know if you've had a chance to review some of the notifications sent by insurance companies, but an attorney has to figure some of this stuff out. But know that and expect that you may be getting some notifications of lessening of coverages, lessening of limits. Again, when you start to get these notifications, do go over them with your insurance broker. They may not impact your organization, but do expect that in the next year or at renewal that there may be some limitations. So workers' compensation. You know, we all know that by law in California, everybody must carry workers' compensation, whether they have one employee or they have 1,000 employees. As in May of this year, the governor made some changes to, in March of this year, the governor made some changes with regard to workers' comp, and I think it was from March to July, making it easier for employees that have COVID to file a claim. Long term, this may be very costly for nonprofits as the rates start to go up. We've had a few COVID claims in our office that have been reported and are being taken care of right now. Usually when you have a workers' compensation claim, it is up to the employee to prove that they got this claim while they were injured at work. The insurance company investigates the claim, and you usually have an adjuster that is looking at the claim to make sure that it happened during work. With this new requirement, it makes it a lot easier for a period of time for an employee to say he contacted COVID at work. So be aware of that, and the fact that we do anticipate more workers' compensation claims. So what should you do to mitigate claims? Follow closely CDC and OSHA guidance for minimizing or preventing exposures in the workplace. We have been starting to see, for your information, more injuries from employees that are working from home. It's not like you're in the office where you as the manager or the executive director can make sure that the area is clean or picked up or that there's nothing on the floor. People are starting to get hurt working at home. And also if they don't have the appropriate chairs to sit in, they don't have the appropriate ergonomics, you will start to see injuries in those areas. So do be aware of that. If you're planning on your employees being home long-term, they should have the appropriate equipment so that they can work effectively and not get injured. And you need to update your injury and illness prevention program, the IIPP. So the IIPP, it's everybody has to have it. If you have an employee, you must have an IPP, which is a safety program created to identify, address, and record work hazards. California requires that everyone establish an IIPP. And if you have 10 or more employees, you must have this in writing. And you must be true to it. You must follow what you have designed and work with to make sure that our employees are in a safe work area. I do recommend that if you haven't already done so, that you add a COVID-19 addendum to your IIPP to address the COVID-related safety issues. We do have samples here in our office. If you don't have one, you can contact us or contact the organization and we will get them to you if you haven't already done so. It's important that everybody have this added to their IIPP program so that you can more effectively focus on COVID-related issues. And just a warning, employees that don't follow the law or choose to not really focus on this at this time, know that there are penalties and that OSHA is looking at this, Cal-OSHA is looking at this. Okay, so employment practice liability. This is an area, as I said at the beginning, where we do see claims happening. We do see them happening, and we have our first COVID claim with a nonprofit that is in shock as we speak. So what I decided to do in this screen, you'll notice in the top there are several questions. These are questions that need to be addressed by an attorney, but I mention that because, as I said before, employment practice liability is designed to defend, protect the nonprofit organization if lawsuits are brought against them by an unhappy employee. But now with COVID and the fact that there are so many requirements at the state level, the federal level, the county level, how do you keep up with all of that? And yet you need to, because an attorney can go after you if you don't. So these are questions that you need to think about and deal with if you haven't already done. And know that your EPLI policies may address some of these, but not all of them. So can employers require employees to travel? Can employers terminate employees that refuse to come back to work or insist on working from home? Can telecommuting create challenges in accurately tracking work hours? Let me just say something about that. Wage and hours is an area that most of you may be very familiar with. And as you may know, there is no insurance for wage and hour type claims. So if you are having challenges with employees that are working from home accurately tracking your records, you need to make sure and get that addressed. There isn't insurance that is going to cover you for that. We do have a few insurance policies or insurance companies that will provide some kind of defense, maybe $100,000 or $200,000 in defense. In other words, they will pay for your legal fees, but they will not cover you if you are accused of a wage and hour issue. This is a big issue moving forward. I keep on going. What risks are created from decisions about layoff, furlough, and reduction of hours? Well, again, this has to do with employment practice, and we are starting to see litigation because of layoffs and furloughs. And we even have one claim that, it's not a claim yet, but it may be a claim having to do with age discrimination because they let her go and she was over 50 as opposed to others. So how should employers handle employee quarantine cases with respect to employment and health-related privacy? Oh, gosh. And how will COVID-19 absences affect employee wages and do not create an exposure for employers? Again, this is going to require the help of your HR professional and employment attorney in case this hasn't been addressed in your policies or employment manual. A good thing about employment practice policies is that a large majority of them, one of the goodies that they offer is that they offer free insurance, free legal advice. Anytime I have a client that calls and is asking one of these type of questions, the first thing I say, if you don't have an employment attorney, let's look at your employment practice policy. They may be able to offer you free advice. Some offer free advice for as long as you need it. Some will offer you free legal advice for 2 to 5 hours with an employment attorney. You want to make sure as we're moving forward and because of all of the changes and requirements that we consult with attorneys that specialize in employment law and that you get the right advice as we move forward. All right. I think we should stop right here before we move on.
Yeah, Lillian, did you want to take a 5-minute break?
Yeah, I think we should take a 5-minute break because there's a lot of other stuff here. And I think, I think that would be a good idea.
Okay, everyone, so we'll take a 5-minute break. So we will reconvene at 1:50.
All righty. How we doing, Judy?
Okay, I think we can start again. Welcome back, everybody. Just a reminder, I'm Judy Ramos. I'm the program coordinator with the nonprofit partnership. I'm going to re-enter my contact info in the chat box just in case anyone needs to reach me. And feel free to post any questions you have in the Q&A box throughout the session, and we will be taking pauses to address those questions. Does anyone have any questions now? If not, okay, Lillian, you can go ahead and start again.
Okay, so we're talking about the various insurance coverages that may or may not help an organization if they get hit with a lawsuit during this pandemic. And we've already said that employment practice liability is an area where you can have some defense if unhappy employees decide to sue for either discrimination, retaliation types of claims. Now, what I'm talking about is general liability. Most nonprofits do carry a general liability policy. If your organization is accused of giving or contacting the virus to someone from the outside, if I go and visit you, if a volunteer goes and visits and catches COVID and they decide to sue you because of that, your general liability policy in general covers claims or suits for bodily injury, which a COVID would be a bodily injury. So in general, yes, your general liability policy would defend you in the event someone was accused your organization. But there is an exclusion, which I think is pretty obvious, but I still want to remind you of this. If there is what we call an expected or intended injury, if you have knowledge that something is not right, or that people have COVID, or that there's a high expectation that they will get COVID, and you still allow people onto your premises or allow people to work in your area, that could be considered an intentional act, and there would be no coverage under liability for that. I've not had a claim like that, but you certainly read about them in the books, and it's been out there where companies have their staff working even though some of them have COVID. So that's not something that would be covered under any policy if there is an intentional act. So be aware of that. Special events liability. We're not getting too many phone calls right now with our clients that are planning, fundraisers and special events at a physical site. The big thing right now has to do with events that are held on Zoom or some other type of social media platform. And I've seen some very successful ones. But due to the pandemic, special event liability insurance is not something that is readily available right now. And many special event policies are excluding COVID. So the best thing that we can offer you right now, if say next year you're planning one, is we'll see what the industry looks like in a year from now, 6 months from now. But it is important that you discuss with your attorney the use of waivers and hold harmless agreements as you're planning special events. Also, as I said before, cancellation event policies may not cover COVID. So I don't know if it's really worth it to buy an event policy if it's not covered. But again, things may look different 3 months from now. As I said, the trend is towards social media fundraising, and hopefully you'll have a cyber policy that will protect if cyber criminals go into your system and take funds. So be aware of that. The bottom line is in the future, when you're planning events in the future, implement strategies that will mitigate the spread of COVID to protect your organization. And even beyond COVID, make sure that in the future, we're going to look at things a little differently, and that any activities that you plan, that there will be more of a focus on safety and wellness. So volunteers, I'm a volunteer myself. The volunteers are the backbone of many nonprofits. But unfortunately, as far as volunteer accident insurance, which is insurance that would insure volunteers if they were injured, there are exclusions under that policy for sickness, COVID-19. So there would not be, for most policies, not all, but most of the standard carriers would not provide coverage for volunteers that are injured or contact COVID while volunteering on your behalf, which is why it's critical that when you're implementing safety and loss control programs, that you focus in on your volunteers and the services that they are providing. And if they're out in the community, that they are provided with the equipment that they need, the masks that they need, the hand sanitizer that they need, and that social distancing is implemented as your volunteers help your organization. So cyber risk and COVID-19, this is going to be big in the next few years because employees are now working from home. I am not a cyber person, I'm not a techie person, but I know that from talking to my own tech people that work for me, that it's important that you have an effective cyber risk policy that protects your data, especially when you have employees that are working from home. Especially if the equipment that they're using at home is not yours. How are you protecting the data that is being transferred from their office to yours? So there are things that you have to deal with your staff, your remote staff, as far as how are you protecting the data, and are your employees properly trained? Do they understand what needs to be done to protect your organization? And I'm also sharing with you down at the bottom a very informative website. It's called privacyrights.org. You can actually go onto this website and it'll share with you, going back, I don't know, 10 or 15 years, the types of cyber claims that nonprofits have had. So it's very informative. I always tell clients, go and look there so that it can give you ideas of what to do to protect your own organization from looking at actual claims that have been reported. So be aware of that. It's a very informative website. So now what? The new norms, working from home. I don't know if this is good or bad, but studies are showing that a significant number of workers want to continue working from home after the pandemic ends. I have many clients telling me that this is a good or a bad thing. It's a good thing because I have one client that said to me, our lease is coming up next year and we are going to cut our space in half because we now know that we can do lots of our work from home. And so, it can be a good thing. But other nonprofits, based on the services that they provide, need to have the people back at work. And so coming up with plans where they are coming back to work and that your data is protected will be a challenge. Cyber risk will continue to increase with remote workers. It will be challenging for organizations to protect systems and employees from hackers. Have a good working relationship with your tech company or your tech employees. It's important that a lot of attention be focused in on this, especially as the new norm will be lots of people working from home. And again, as I mentioned before, how are your employees working at home? I have a staff person who would tell me that her husband, who also works from home, works on the kitchen table, which I thought was fine. But then I've been to their home and they have a bench. They have benches as where you sit. Well, sitting on a bench all day in your kitchen you're just asking for trouble. So again, it's details like this that we have to think about as we are working from home so that we implement long-term effective risk management practices. And then again, working from home, there is a possibility that your workers' compensation claims will increase. And just so that you'll know, as a side note, the workers' comp, the WCAB is planning on adding new classifications next year that have to do with employees working from home. So if you classified your employees as clerical people in the past, there may be a new classification if they're actually working from home. Whether it will be higher, what the rates will be, I don't know yet. That those haven't come out, but there is a change going on with that. So do be aware of that. These are lists in our industry, we call these cyber perils. And I'm spending extra time on computers, networks, because this is an area from a risk management perspective where you can have problems in the next year. So cyber risk, pandemics and the computers, networks, this is a very dangerous area, but know that these are the areas where we are seeing claims and lawsuits. Either there's sabotage going on in your organization with the network, human errors. We had one recently, just so that you'll know the kind of human error I'm referring to, where an HR employee accidentally sent out to the staff the names, contact information of the employees, and it had lots of confidential information. That had to be reported to the state of California because it was out in the internet. And there's things that have to be done at a state level to correct that from happening. Virus transmission, if you have employees that are contacting you through their phone, how is viruses being protected from that? The system malfunction, that can happen, and of course fraud. So go back and look at your cyber risk policy. What access, training, and controls are in place for your computer network? By the way, how are your volunteers being trained if they're using computers also? How are employees working remotely and being trained on cyber safety? And how often are employees trained on how to sanitize the area that they're working in? They're doing that, I'm assuming, whether they're at home, but also when they come back. What are the protocols that are in place? And do you have the equipment that they need so that they can clean their computers or their laptops every day while they're there? Again, this is the new normal. Working this all out right now is how we move forward on this. So collaboration. Let's face it, nonprofits, they collaborate. This is how they function. They work with other nonprofits. They work with counties, with cities, with other entities. This is how they accomplish a mission statement. This is how they work. But due to the pandemic, many nonprofits are collaborating with cities and entities, but perhaps the agreements that should be there are not. Part of your risk management plan is going back and taking a look. Do you have the appropriate agreements in place? Whether it's an informal collaboration or a very formal collaboration where possibility of mergers and sharing of services, it's important as part of your risk management plan that you have the appropriate agreements, the appropriate MOU in place between yourself and another entity, yourself and the city, the county, and that they are reviewed. They should be reviewed by an attorney. Does the collaboration obtain an indemnity clause? Again, an attorney should be reviewing that for you. And does the agreement require insurance? Does it require additional insurance? Is it something that can be done? Because we're in the mode of figuring things out and working with other entities, let's remember that having the appropriate agreement or MOU, whatever you want to call it, it's important that it be done correctly and that everybody is agreeing with what is written, because we see more potential claims when there isn't an appropriately written collaboration or MOU, because it's something that you're doing. I have one client who recently said to me, you know, we do this informally all the time. We do this and they do that, and we've been doing it for years. And my advice to them was, you should talk to your attorney, because I do see some liability exposure here, but you should talk to your attorney. What if one of you is not happy at some point with what's going on? You know, it's something that should be addressed. And I think that more should be done in the area of collaboration, especially in the next few years.
Lillian, we have a question.
Sure.
With shelter in place and social distancing, how do you recommend we assess and enforce ergonomic workstations in people's homes? Will an email advising employees with what proper ergonomic workstations look like and an official recommendation that they strive to meet those requirements be enough?
Yes and no. Yes and no. It's first of all, what I would do, and I do have clients already doing this, that's a great question, is contact your workers' comp carrier. There's a lot of information that they can provide for you to share with your clients, and it should be ongoing. It shouldn't be you let them know once and they should know. It's continually letting them know that this is what is safe for them while they're working there. The other thing you have to take into consideration is if they are working for you at home, and this is going to be acceptable long term, you may have to consider providing them with the equipment that they need to work from home if they can't get it. In our particular case, you know, I have made the conscious decision that my staff will be primarily working from their homes for the next year, and we will be coming into the office one day a week, and we'll come in at different times so that there are no more than 2 or 3 people in our office at any one time. So because I made that conscious decision that this is what is safest for my staff, I've provided my staff that need chairs with appropriate chairs. I always think about that bench where people are sitting on with appropriate chairs, and also sent them information continually on where the computer should be, how you should look at it level, and continually remind them of that, because one of the areas that we are starting to see claims is with workers' comp is that they don't have the appropriate ergonomics, and so their backs are hurting them, hand injuries. We are starting to see that. I do believe that you, from an effective risk management standpoint, that you should let them know more than once. And if you are able to do so, I dare to say that you should provide them with the chairs that they need if they don't have them, or whatever other equipment they need so that they can work from home. Talk with your attorney. And I say that because things are changing every day. I'll share with you that I recently went to the County of LA, and I saw their they have a whole section there on office. I'm in office to see that I'm complying with what is being required, and so I primarily use the County of LA's guidelines. I do also use the state of California, but the County of LA seems to help me more. And just in the last 3 weeks, they've added 2 more paragraphs with regard to offices and working from home. So be informed, but I truly believe that if they don't have the appropriate seating and long-term they're going to be there, that you do need to address this and provide the appropriate equipment for them. Because but rest assured, they will file workers' comp claims, and we do have a few of them already in hand. And then they've got nothing to do with COVID. That's another matter, but not being in the office and not having the appropriate equipment. And also a reminder, by the way, we have a client that tripped over she's got a 2-year-old, and she's a very good employee. She's been there for many years, but she tripped over the little walker thing that the babies walk in. She tripped over it because she was busy looking at something, and she injured her, sprained her ankle, severely sprained her ankle. She could still work from home, but she needed a lot of therapy for her sprained ankle. And I thought, the employer should continually remind them that you need to have an area that is your work area. This is not where baby toys are at, even though it's hard. I'm a mother of 2. I remember stuff being all over the place, even though my daughters are grown women now. It is a place where they are working, and so reminders that are actually put out, a lot of workers' comp carriers. The state fund is an excellent resource for those of you that are with the state fund that provide you with information. And those of you that may be my clients, we have lots of information, and you can also check on our website. We have information on that also. Did I answer that question?
Thanks, Lillian.
Okay. Also, work with your insurance broker. If you are collaborating with another organization, if you are making changes, if you have more staff working off and on, you really do need to let your broker know. Most insurance companies are now providing reductions in premium based on the changes in your operations, but you have to tell your broker. Because every insurance company requires different information. We have one carrier that they require that you fill out a form and then they'll reduce your premium. Another one wants a biography before they'll reduce your premium. So you need to work with your broker and say, hey, is there anything that can be done right now to lower my premiums? And rest assured, for most of you, there is. It may not be a lot, but you definitely can have your premiums reduced if there are changes in your operations right now. And so in our office, that's one of the things we do. Once a client contacts us, we immediately find out what carrier they're with and then provide them with the information that they need to give us so that their premiums can be reduced. And with regard to workers' compensation, your premiums will only go down if your payroll goes down. And while I see that some payroll has gone down in March and April, I see an uptick in premium now. And so expect that your workers' comp premiums may not be going down if your payroll is going up. So I know it sounds like an obvious thing, but I had a client call me the other day and told me I felt terrible. He said, we're in COVID. How can the insurance carrier increase our premiums when we're doing a lot of extra expenses and making sure that everyone's at home and safe? But his payroll went up. And there's not much I can do when it comes to that, or that any broker can do. Other than we can possibly change classifications if you're doing something different. But you would need to have a serious conversation with your workers' comp insurance broker about changing a classification. And we have done that with a few clients where they decided to make some overall changes to their operation that will save them a considerable amount of money. So the new normal, I don't know, they call it different things. We have to prepare for the new normal and frankly beyond. The new normal is going to, for the next year or two, is going to be about social distancing, wearing face masks and whatever political views you may have on that, employee screening, concerts and special events will not be possible for a while. Restaurants will primarily still continue to be takeout or eating outside at some point. Classrooms and conference rooms will need to be reconfigured. Office equipment and offices, how are you going to deeply clean? Did you contract with someone to do this? This is going to be an ongoing thing. They're talking about a second wave and possibly a third wave. How are you going to prepare for that long term? And working remotely, I personally believe that working remotely has changed the world. And I think it's a good thing because I enjoy working from home. I miss going out to see my clients. So part of the fun of being an insurance broker is that I get to work with so many nonprofits and see what they're doing. And I'm not doing that right now. I've made a conscious decision that it's time to stay home and talk to my clients via Zoom. But working remotely, I believe we'll be here for quite a while. So we need to develop our plans, our risk management plans to prepare for our new normal, knowing that even after COVID is under control, the way we did things before may not be how we're doing them in the future. So we as nonprofit, and I sit on a board as nonprofits, have to prepare for that and make moves so that we are successful in accomplishing our mission statement while at the same time implementing the effective risk management and safety policies that need to be in place. Again, one of the things that I want to remind you of that I can't say enough about is that you keep good records. I see litigation coming on many different fronts. And so one of the things that will help out your attorneys that defend you enormously will be to keep good records, whether it's with your disinfecting, whether it's how you're implementing safety procedures in your offices. And also every time that you communicate with your employees, those records should be saved so that it's clearly understood from the beginning that you were a good steward, that you tried to protect your employees, that you did everything that you possibly could to make sure that they are safe. OSHA and these are some places that you can go to get information for safety. But again, I find some of the most helpful information from the county and the state. But I've gone to the county of LA for a lot of information, and they provided a lot of good information, as do the workers' comp insurance carriers. But again, document. Your attorney will thank you later if you have to deal with the litigation. And with that, I like to end on this note by Dr. Fauci. Science is telling us that we can do phenomenal things if we put our minds and our resources to it. I believe that, I hope this seminar didn't sound too depressing, because I do believe we will get over this, and that we just have to be smart right now and implement the appropriate protocols so that we can get to the next few years and be successful. So with that, I thank you all. If you have any questions or if you need a copy of the workers' comp IIPP form, let me know. But I think that I'm done.
Thank you, Lillian.
Thank you.
If anyone has any last questions that they'd like to post in the Q&A, feel free to do so, and we will continue to address those questions. And in the meantime, so TNP has released a survey. We're collecting data. We're interested in learning more about how COVID-19 is impacting nonprofits. So I'm going to go ahead and post the link to the survey in the chat box. So we encourage everyone to please take that survey if you haven't already. Again, feel free to post any questions in the Q&A. Okay, and Lillian briefly talked about cybersecurity. We actually have a breakfast series coming up specifically on cybersecurity. We're going to have speakers from Sharp come and present on that topic. So I'll go ahead and share that event as well with you in the chat.
Everybody should sign up for that. Everyone should sign up for that. I'm seeing lawsuits as we speak on that.
Okay, and we still have about 14 minutes left of the webinar. So again, feel free to use this time to post any questions if you have any.
I think I overwhelmed everybody with it's just so painful, but you know, it's got to be done because things are going to be fine long term. It's just right now. Oh.
Lillian, will we be sharing a copy of the slides afterwards or any other materials?
I can provide. You know what I didn't provide is the workers' comp. And I'm not sure if the people that attended are interested. Is that workers' comp addendum for COVID? They might have already all done that, but it's important to do that with your IPP. And I didn't attach that. That's the only thing that I'm missing. And they might have already all done that, but workers' comp IPP, it's important to have, to address that in your IPP. It helps in litigation.
Okay, thanks, Lillian. Will we be getting a copy of the slides, or is that confidential?
No, I sent the slides to you guys last week. Send them out to everybody. If you don't have them, I'll have Rebecca send you another copy, but absolutely.
Okay, so yeah, we will be sending a follow-up email to everyone with the copy of the slides as well as a recording of the webinar and any other materials that Lillian would like us to share.
Sure.
Okay, and if there's not any other questions, we can go ahead and end early.
All right. Thank you, everybody. It's a good review. Painful, but good.
Thank you, Lillian. That was very informative.
Thank you. Take care, everybody.
Okay, thank you, everyone. Have a wonderful day.